And imagine if you're in a supermarket or a grocery store, it's very contagious. It's an airborne spread.
And that could be our reality if there is in fact a measles outbreak in our state. Our Department of Health is investigating a possible case in Sierra County, but how quickly can measles spread and what can be done to stop it? Our Joy Wang worked to get those answers today and joins us live now with what she learned. Joy.
Well, Steve, first a little background on Sierra County. According to our health department, 96% of students there are current with their vaccinations. Or less than 1% of students have religious or medical exemptions. And now there's a possible case of measles in the area.
As of 2000, we had no cases in the United States. It was basically eradicated from the country. And then what you've seen is immunization rates have gradually declined. We've seen a corresponding increase in the number of measles cases.
The last confirmed case in New Mexico was in 2014. A one-year-old child who had not yet been immunized caught the virus.
So we really start measles vaccination between 12 and 15 months of age for the first shot in the series. The second shot is normally obtained between around 4 and 5 years of age before you enter kindergarten.
Without that vaccination, it can spread very quickly. Dr. Walter Dehority, an associate professor of pediatric infectious diseases, had this real-life example from a 1990 sporting event in Minneapolis.
Seated about 60,000, two unimmunized adults were sitting in the upper deck underneath the Jumbotron scoreboard. A competitor on the field had measles. The two adults in the upper deck of the Metrodome caught measles from the athlete on the playing surface in a dome. And so that's how contagious this is.
And the problem with measles is once you get it, there is no treatment.
We have what's called supportive care, which is making sure that patients are hydrated, they get their fevers controlled, but there is no cure for measles.
The state's health department says because measles cases are so rare, many doctors haven't actually seen a live case, which is why education on what to look for is very important. We're expecting to learn more about the possible case in Sierra County tomorrow. Steve?